Hello, my name is Ashley McEwen. I am a student nurse and I am here today to explain a patient's health history and my findings from 2 assessments performed. The patient is a 19-year-old Caucasian female. She is a single student at the University of Michigan. Her usual source of medical care is her mother's insurance. The patient's chief complaints were foot pain and chest pain. The foot pain began about a month ago and she rated the pain at a 3 out of 10. The pain is in the medial plantar area of the left foot. The pain is not continuous and produces a dull ache or a feeling of... I'm going to start that over. The pain is not continuous and produces a dull ache or a feeling of pressure. It occurs every day while walking. The patient reports that it... What in the world? The patient reports that it is getting better. Aggravating factors include running and walking. Relieving factors include not moving the foot or not walking. The patient reports that sometimes tingling of the foot accompanies the pain. The patient has not attempted to treat it because she believes that it is not prevalent enough. Oh my god. The patient has not attempted to treat it because she believes that it is not prevalent enough for her to seek treatment. The patient reported that chest pain began freshman year of high school. She rates the pain anywhere between a 1 and a 5 out of 10. She reports that the pain occurs about once or twice a month, but it used to occur about once a week. The pain is either sternal or on the left side of her chest. She describes it as a sudden burning sensation with pressure and reports that it subsides within a half hour. She reports that its intensity varies and that it sometimes causes her to have breathing difficulties. Aggravating factors include eating before bed, lying flat, and drinking too much caffeine. She reports that the pain comes on randomly or as a result of one of the aggravating factors or stress. She treats it with Zantac or by sitting up. The patient does not know the exact dose of Zantac she takes. She reports that the chest pain creates panic and immobility. She has had an EKG done and the results were normal. The patient reports having pertussis as a baby and molluscum in high school. The pertussis resulted in hospitalization. She reported that her molluscum had to be removed by a medical professional. She reports that it no longer is an issue. The patient also reports that she has acid reflux, which she treats with Zantac or by sitting up. The patient reports that the acid reflux only occurs with chest pain. The patient also reports having frequent sinus infections. She treats these with Sudafed and nasal spray. The sinus infections make it hard to breathe, create pressure in the sinuses, headaches, and makes her nose stuffy. The patient reports being up due to all... Oh my gosh. Oh, I spelled that wrong. The patient reports being up to date on all immunizations, including the flu shot. The patient has no food allergies. The patient reports that she is allergic to penicillin, which causes hives. She reports that she has never been hospitalized for an allergic reaction to penicillin. The patient reports no allergy to latex. The patient reports that she has seasonal allergies which cause rhinorrhea and a stuffy nose. The patient reports that she takes Zyrtec on a need-to-need basis. The patient has never been hospitalized. The patient reports that the only surgery she has had is wisdom teeth extraction. The patient reports that there were no negative side effects from the procedure and that she is completely healed. The patient reports that she uses Winextin at night and tretinoin in the morning for acne. She reports taking Sudafed once a day. She takes the 4 to 6 hour 2-tablet dose. The patient reports no illicit drug use and that she does not use any tobacco products. The patient reports that she does not consume alcohol. The patient reports that she tries to exercise every day. Her exercise includes running, lifting weights, or abdominal exercises, or a combination of the 3. The patient reports that she gets an average of 6 hours of sleep a night, but she reports that sleep is not always restful and deep, citing that she often wakes up in the middle of the night. The patient reports that she naps occasionally for about an average of 1 hour. The patient reports that she has a healthy diet, eating fruits and vegetables and whole grains daily. The patient does not smoke. The patient reports that she has at least 1 cup of coffee daily, but usually has more. That I educated the patient on the negative effects of excessive caffeine. The patient reports that she does wear a seatbelt but does not wear a helmet while riding a bike. I educated the patient on the dangers associated with not wearing a helmet. The patient reports having good family dynamic. She lives with her mother, sister, and 2 brothers. Her father passed away when she was 9. She reported having good interpersonal relationships with both her friends and her family, both providing her love and support. The patient reports that school is a big stressor and that she doesn't cope with stress well. The patient reports that she tries to have fun and get things done early to help relieve stress. The patient reports that when she feels overwhelmed, she goes running or sits alone on a bench to think. The patient reports that there are not environmental hazards where she lives. The patient reports having strong spirituality. The patient is a high school graduate. She is now a freshman in college at the University of Michigan, pursuing a BSN. The patient reports yearly physicals. The patient also reports annual eye exams as well as dental exams. The patient reports that her father had heart disease, her mother and brother have asthma, her grandfather has diabetes, and her grandmother has dementia. She also reports that her grandfather, aunt, and mother have hip problems and that both of her grandfathers and her grandmother had cancer. She reports that she thinks she is very healthy. She reports being satisfied with her health, but would like to eat healthier. Her weight and energy levels are stable. The patient reports being bothered by the appearance of varicose veins, but that they do not affect her negatively in any other way. The patient reports that she only gets night sweats when it is hot. She reports no fever or chills. The patient reports no excessive fatigue when well rested. She reports that she cannot tolerate sudden changes in temperature. She reports that this is not new. Due to her chest pain and foot pain, I chose to review and do an assessment on her cardiovascular system and her musculoskeletal system. As aforementioned, the patient reports having chest pain about once a month. She rates the pain anywhere between a 1 and a 5 out of 10, reporting that she feels a burning sensation and pressure in the sternal area along with the left side of the chest. The patient reports that the chest pain sometimes accompanies arm pain, but there is no jaw or arm numbness. The patient reports that she has heart palpitations and that a doctor heard a murmur once. She reports that the palpitations have been occurring since the onset of chest pain. The patient reports no treatment for palpitations. The patient reports having a positive change in exertion tolerance, reporting that she can sustain cardiovascular activity longer. The patient reports that there is no change in fatigue. The patient reports having a difficulty lying flat with chest pain or when she has dyspnea. The patient uses 2 pillows under the head and 1 on the side. When the patient has dyspnea, where did it go? When the patient has dyspnea, she uses all of the pillows to prop herself up. When asked about her musculoskeletal system, she reported no joint pain, swelling, redness, warmth, or deformity. The patient reports that her left ankle has less range of motion than her right. The patient reports no limitations in performing daily activities, but that the foot pain is annoying. The patient reports no weakness. As previously mentioned, the patient reports having pain on the medial plantar portion of her foot. The patient reports the pain as a 3. The patient reports some swelling and that cramping sometimes accompanies the pain. The patient also reports having shin pain, which she also rated at a 3. The patient reports that she does not take any medication for the pain. The patient reports also having gone to a physical therapist to realign her back and hips. The patient's heart rate was 76, her respiratory rate was 14, temperature was 98 degrees Fahrenheit, and her blood pressure was 112/76. I then did a cardiovascular assessment due to her chest pain. I did not see any heaves or lifts over the 5 key areas. The patient's chest has normal contour with no barreling. There were no palpable lifts or thrills over the 5 key areas. While auscultating the 5 key areas, the aortic area, the pulmonic area, the Erb's point, the tricuspid area, and the mitral area, with both my bell and diaphragm of the stethoscope, I heard clear S1 and S2 sounds. I did not auscultate any S3 or S4 sounds or any murmurs. I then had the patient lie on her back and then on her left side, and I then had the patient lie on her back and then on her left side, and clear S1 and S2 sounds were once again auscultated with no S3 or S4 sounds. While on her left side, I auscultated for S3 and S4 sounds using the bell of my stethoscope. After the cardiovascular assessment, I performed a musculoskeletal assessment. The patient has good muscle mass and normal bone structure throughout her body with no noticeable deformities. The patient had correct posture and normal gait. When I assessed the patient for scoliosis, I palpated a slight curvature in the lumbar region of her back, indicating mild scoliosis. Her TMJ had full range of motion, and I did not palpate any arrhythmia, inflammation, warmth, pain, or crepitus. I then palpated her neck, shoulders, elbows, wrist, and fingers. They all had full range of motion and did not have any arrhythmia, inflammation, warmth, pain, or crepitus. I then palpated her neck, shoulder, elbows. I just read that. When assessing her hips, I noticed that her right one was slightly higher than her left one, but her hips did have full range of motion and had no arrhythmia, inflammation, warmth, pain, or crepitus. Her knees also have full range of motion without arrhythmia, inflammation, warmth, pain, or crepitus. While palpating her ankles, her left ankle was not able to plantar flex as well as the right ankle. There was also some tenderness and swelling on the medial plantar portion of the foot where she reported having pain. There was no arrhythmia, warmth, or crepitus. The patient had full range of motion of the spine with no arrhythmia, inflammation, warmth, pain, or crepitus. I then tested muscle strength of her deltoids, biceps, triceps, wrists, fingers, hips, hamstrings, quadriceps, and ankles by creating resistance, and all muscles were graded with a 5. 2 other assessments I would do based on her health history would be a peripheral vascular exam because of her varicose veins and a respiratory exam because of her history of asthma. Based on a study in Finland, people with varicose veins are at higher risk for arterial disease. This would lead me to do a peripheral vascular assessment and check for any signs of arterial disease, which could be noted by weak pulse in her lower extremities. I would do a respiratory assessment because a journal article done by the AAP Grand Rounds found that people that had certain childhood infections, including pertussis, which my patient had, have a higher likelihood of developing asthma. Her family history of asthma would point me to this assessment as well. This concludes my information and health history on my patient.